I said this is the renal and urinary disorder. We are just going to figure out some key point to understanding and also what NCLEX board asks the question. First of all, glomerulonephritis. We said it is the inflammation of the kidney. Inflammation of the kidney, right? So basically here, this is the kidney, inflammation in that tissue, infection. Usually infection because of any underlying infection or sometimes autoimmune or immunological problem, right? Or when patient come to you, you are the healthcare provider. When they come to you, definitely they will not say, I have a glomerulonephritis, please give me the treatment. You have to find out by asking the question, relevant question, right? Usually patient give a history, I have a sore throat, or I have a pharyngitis, or any kind of skin infection like impetigo. So if anybody has a sore throat or pharyngitis, this is the source of infection. If it is untreated, maltreated, this infection is spread to the kidney and causes glomerulonephritis. So the key word here, this is the inflammation of the glomeruli. What is glomeruli? This is the glomeruli inside the kidney. Another thing, the functional unit of the kidney is called nephron. The functional unit of the kidney is called nephron, right? It is structural unit of the kidneys. So basically, I'm saying like here, this is the nephron where the urine formation, right? And this is the glomeruli. Inflammation of this area causes glomerulonephritis. There are so many glomerulonephritis inside this or inside the kidneys, right? So kidney is an organ where urine formation. Kidney is an organ where blood is filtered. So when blood is going through the kidney and come back, the waste product is expelled out inside the urine. And also the good product is reabsorbed from the renal tubules to the body. Waste product passing by. So nephron is the organ where the urine formation, right? So here I said we are talking about the glomerulonephritis basically. So if any patient or children, we are talking the pediatrics, children has a glomerulonephritis, sooner or later their kidney function shut down. Kidney, loss of the function of the kidney, right? Because of inflammation. And underlying cause, we said infection, autoimmune disease, or immunological disease. Sometimes they ask, what are the organism name can cause the pharyngitis that affect later the kidney? This organ name, group A, beta hemolytic streptococci infection. They causes pharyngitis. If your baby do not take the antibiotic or they do not complete the antibiotic course, maltreated, the chance of infection spread to kidney and causes glomerulonephritis, right? So if anybody has a glomerulonephritis and it is not treated, complications start. What are the complications? One is the kidney function fail or kidney failure or hypertensive encephalopathy. What does it mean? If my kidney does not work, the waste product accumulate in the body. This waste product actually nitrogen content substance. This waste product increase in the body and passing through the blood and attack the brain, and patient has a confusion because of azotemia. Uremic sign symptom develop, and this is called hypertensive encephalopathy develop because of underlying cause of kidney problem. Because kidney or function, the waste product has to be expelled out from the body. When kidney does not work, the waste materials accumulate in the blood and causes toxicity. What is this waste product? Nitrogen substance, nitrogenous content substance, right? And also they lead to pulmonary edema, they lead to heart failure. Complication of glomerulonephritis if we do not treat the baby. Now, I said, if anybody has a glomerulonephritis, what are the signs and symptoms most common? One is they develop the anorexia. They develop the anorexia. Then, okay, so the most prominent sign and symptom of glomerulonephritis, patient develop the periorbital edema or facial edema, right? So this is the baby in showing his eyelid is a full, accumulate the water inside, in the face. It's called facial edema. If anybody has a facial edema or periorbital edema, always it indicates that the kidney dysfunction, kidney not functioning, right? If anybody has a pitting edema, the fluid accumulate in the foot. This is called pitting edema. Pitting edema because of heart problem. If anybody has a ascites, means the fluid accumulate inside the abdomen. This is the abdomen, fluid is accumulate here and causes the ascites. Ascites indicate they have a liver problem. So kidney problem, they have a always pitting edema or facial edema. If the heart problem, pitting edema. If the liver problem, ascites, right? So what are the other signs of glomerulonephritis? Other sign of glomerulonephritis, anorexia, decreased urine output, right? So if kidney does not work, so definitely urine formation should be go down. One, and glomerulonephritis, we said the underlying cause is the infection. So if underlying cause of the infection, the urine should be cloudy. Cloudy means pus formation because of infection. And sometimes hematuria. Hematuria means urine mixed with blood. And patient develop the pallor or lethargy, hypertension, and also proteinuria, right? So proteinuria means protein in urine. So usually if any healthy baby or healthy individual, if you check the urine, urine should be protein less or no protein. If anybody has a protein is there, we say proteinuria. But why protein is there? Because kidney does not work well, does not function well. So protein molecule is passing through the glomerulus and present in urine, indicate the kidney function dysfunction. So same I said, the urine supposed to be less or absent the blood sugar. If blood sugar in urine indicate pancreas does not work, means diabetic. And also the blood, urine usually and healthy individual do not contain the blood. If blood is there, indicate hematuria, underlying pathology. If WBC present inside the urine, indicate underlying infection. So a simple urine microscopic examination indicate so many problems. Also, we said if patient has a kidney problem because of glomerulonephritis, nitrogen product does not expel out from the body when nitrogenous substance increase in the blood, and this is called azotemia. So here increase the blood urea, nitrogen and creatinine level. So the kidney function test is called creatinine, right, and urea nitrogen level. They indicate kidney functioning or not. If patient has a glomerulonephritis, we have to check for streptolysin O titer. It should be positive, right? Streptolysin O titer. It indicates maybe the baby is infected with the organism beta hemolytic or streptococci infection is present there, right? So if anybody has a kidney problem, especially the baby glomerulonephritis or nephrotic syndrome, we say the fluid is accumulated in the body. So as for the NCLEX board, is very important. We have to know that every day we have to monitor the patient daily body weight. It is indicate the fluid is accumulate or not. So measuring the daily body weight and assessing for the changes is the most useful or most effective measure to determine the fluid retention or fluid balance. If the baby every day, like today is 120 pounds, tomorrow 130 pounds, day after tomorrow 145 pounds, means the fluid is accumulated in the body, fluid not expel out through the kidney, right? So the edema or fluid accumulate we can measure by the daily body weight measurement. These are tools we have to know for NCLEX board.